Cedar is an endorsed business partner of the association, and I'd like to thank Seth Cohen, president of Cedar, for the outstanding partnership thus far. HASC performs a lot of due diligence on our partners, and because we want to really make sure that our partners are aligned with our strategic priorities and really can provide value and solutions to our member hospitals. Seth will be providing background on the Cedar product and its ability to improve consumer engagement and to include results of a new financial experience study. Our second presenter is Jeremy Church, and he is the Chief Financial Officer of USC Care Medical Group. Just for clarification, the SC stands for Southern California and not South Carolina. Go Children's. Jeremy will be covering USC's patient experience and engagement journey over the past 3+ years. I just want to note that there should be ample time at the end of the presentation for questions, so please feel free to use the chat or the Q&A function on Zoom. So without further ado, Seth, please take it away.
Thanks so much, Paul. I really appreciate this time and this opportunity. And thank you, Jeremy, for partnering with me on this webinar. So I'm going to start by sharing just a little bit about Cedar, what we do and what we're all about, and then excited to turn over to Jeremy to share some of the impact we've had at his system. And so at Cedar, our mission here is to empower us all to easily and affordably pursue the care we need. Those words are very intentional for us and really important. As we believe now more than ever, patients need help navigating the very challenging financial obligations that often emerge as a result of care. We're really proud of our growth and where we're at. We're only 7 years old, but in those 7 years, we've been able to serve now 30 million patients annually across 55 client partners. And we process about $10 million of patient bills a day. So it's given us a scale and a level of impact that we're super proud of. We work with many wonderful clients, not least Jeremy and his team on this call. You can see a couple of those mentioned on the top right hand of the page. So a lot of large health systems like Providence or USC, Christiana, as well as large physician organizations like Teen Health and Vision. You also see this reference to network partners. We'll explain a little bit more about what that means, but this is something very special and very unique to Cedar. And the idea behind these network partners is that if we take a truly consumer-centered view of the patient billing experience, so in other words, if we really think about what it's like to be a patient and put ourselves in their shoes, we'll quickly recognize that the provider bill is only one part of the puzzle. And so we're delighted to work with these partners, insurance companies, HSA banks, and financial assistance programs to really make sure we're catering to the consumer need holistically. So with that mission, just a moment on why we think this mission is important and why we think this is frankly more important than ever. We recently, and when I say recently, it's hot off the press, just yesterday launched the results of a survey we did with over 1,200 US consumers. We did it in partnership with The Economist. And we do this annually because we think it's really important to make sure that we're grounded in what consumers feel to be their experience in healthcare. And we focus very much on the financial component of that experience. And I think the three key themes that we hear from consumers very clearly is they want more support and certainty into their financial obligations. The not knowing or not being sure takes a real toll on consumers as they navigate the healthcare system. The second thing is this idea of fragmentation. In a hospital encounter, right? A consumer may go into a hospital for a single encounter, but they could leave with a facility bill, a professional bill, an EOB from a health plan, a banking statement for an HSA balance. And that fragmentation is really difficult for a consumer to navigate. It could take 6 to 7 different places just to resolve one healthcare episode. And so that's a challenge that we hear from consumers. The good news is that while these challenges are significant, there's real upside to getting it right. And what we hear very clearly from consumers is that when a provider is able to meet them where they are and help them with their financial obligations, loyalty ensues. And in fact, more than ever, we are seeing consumers say, if you look at the top right hand of this page, that over a third say that they would switch a provider due to a bad billing experience. And especially with virtual care, those choices are more prevalent than ever. But about half of folks do say they've been impacted negatively by a healthcare bill. The majority of consumers do not feel like they know what options they have to get support or aid for their bills. And the vast majority say that coordination between their provider and payer is super important. A lot to learn, by the way, in that survey. If you're interested in hearing more, check out our press release on it from just yesterday. And we can send it, of course, after the webinar. For providers, oh, my slide took a second to move. We recognize that addressing these consumer needs is really tough. Consumers deal with this fragmentation, but a provider can only do so much with existing tools and resources, right? How is it that a system like USC, how can a system like USC navigate and all these different things that a consumer touches, right? Whether it's prior authorization, insurance benefits, HSA, the facility component is only one component of the full picture. But what we really believe and what we really think is critical is that we want to equip our provider partners with a system of engagement that would sit on top of a system of record. So what do we mean by that? So all providers have systems of record. These are very common in industries writ large, right? So most large companies will have ERP. These are the three-letter acronyms that we're familiar with: ERP, CRM, EHR, right? These are systems that manage data and help support kind of enterprise priorities. But in every other industry outside of healthcare, those systems of record are different from the systems of engagement. And a great example is the travel industry, right? In travel, there are these major systems like Sabre that are the repository for all the pricing and route schedules for airlines. But no consumer interacts with Sabre directly. Most of the time, or frankly, all of the time, you have these systems of engagement like Expedia and Kayak and Travelocity that are pure consumer engagement systems that sit on top of that system of record, right? And thankfully, they exist because we are able to then easily navigate flight options and choose things in self-serve. But in healthcare, we're still stuck in a different paradigm. Those systems of engagement are few and far between. And too often we find that hospitals are trying to get their system of record, namely their EHR, to perform the functions of a real consumer engagement tool. And so what we're excited to share more about is our journey working with Jeremy and his team on helping USC build a system of engagement to really empower that consumer experience and not rely solely on a system of record. So when we talk about system of engagement, that's a really high level concept. So let me ground it in a couple areas of what we do. So Cedar is a financial platform focused on the patient experience. And there are two components to that Cedar platform. The first is Cedar Pre, and that's basically the experience of onboarding you into the provider. So everything from the appointment scheduling to the confirmation, estimate of what you're going to owe, collection of copay, insurance verification, kind of all those steps that you might have to deal with at the front desk or on a clipboard, we're digitizing and making super simple for the consumer. That's Cedar Pre. And then on the back end is Cedar Pay. And that's basically you've left the building and you have a bill that needs to be resolved. And how do we help you do that in the most simple and affordable way possible? For us, it's really powerful to be able to offer a front end and back end experience that can be consistent, right? And that can remember and follow the patient from before they show up until after they've left. And there's a couple ways in which Cedar is unique. One is this idea of optimization. And what this means is we don't believe that any single consumer should be talked to in the same way as someone else, right? That everyone deserves a personalized and unique experience. That might sound obvious because all of our Amazon pages and Netflix pages are all unique to us. Our Spotify app is unique to us. But yet in healthcare, that is still a unique concept. I would argue that most providers out there still send the same bill with the same language at the same cadence to every patient, regardless of income, demographic, or preference. The second principle that makes Cedar unique is the idea of connected. And this gets back to the network partners from before. We believe really strongly that a patient shouldn't have to navigate and figure out how a payer EOB matches a provider bill, or how to find their HSA account when they are trying to pay with their HSA dollars. We need to bring those things to the patient. So we make connections with HSA banks and payers and financial assistance programs and bring those into the billing experience so that a patient doesn't have to navigate multiple sites. And last but certainly not least, we are accountable for our results. And I think this is maybe the most important because we get questions all the time on, well, do you have the same features as this thing or this other HR? And what we try to kind of reinforces this. It's less about the features and more about the results. And we're really proud of the results we deliver with USC, which Jeremy will talk about in a moment. And in general, very proud of our ability to drive meaningful improvements in cash collections while ensuring a really positive patient experience. This is a great picture to kind of visualize that idea of that network and the connections that we're making across the ecosystem. Because again, what we believe very firmly is a provider cannot solve the billing problem alone because the patient has so many touch points with other places in the ecosystem. So these connections with HSA banks and payers and EHRs are super critical so we can bring all that to the patient versus having the patient navigate it themselves. And with that, I'll turn over to Jeremy to show the impact of this work.
Thank you, Seth. Happy to be here. We're going to share a little bit about our journey here at Keck Medicine of USC towards a digital transformation, and also share with you a little bit why we think digital transformation in the patient financial experience realm is an especially attractive area to invest in. We'll talk a little bit about our approach to vendor partnership in this space, and then conclude with some highlights of our achievements with Cedar. But before I get into all of that, let me just give a little bit of a background on Keck Medicine of USC. We are the medical enterprise of the University of Southern California. We're one of only 2 university-based medical systems in the Los Angeles area. Our 2 flagship academic medical centers are Keck Hospital of USC, 401-bed TQ facility, and USC Norris Comprehensive Cancer Center, which was one of the 8 originally designated centers by the National Cancer Institute. We now have 2 community hospitals in our healthcare enterprise, USC Verdugo Hills Hospital, which has been part of our enterprise for a number of years now. That's a 158-bed community hospital. And our most recent hospital join is USC Arcadia Hospital, previously Arcadia Methodist. And that's a 348-bed community hospital that joined us on July 1st of 2022. I reside within the medical group and ambulatory section of the enterprise on the right side there. We have USC Care Medical Group. That is faculty practice plan of the Keck School of Medicine, and also includes employed physicians in our community medical group, as well as advanced practice providers. And we have about 40 ambulatory clinics across Los Angeles and Orange counties. Just give you a sense of our scope and scale. Additionally, and sort of recognitions, we're top 50 hospitals in the country in 8 specialties on US News and World Report. Last fiscal year, we did $2.5 billion in annual net patient revenue. We see about 685,000 ambulatory visits a year. Our faculty employed providers are about 1,300. We do have a significant academic portion of our mission. We have 70 ACGME training programs, almost 1,000 residents and fellows in our affiliation with Los Angeles General Hospital, and do a significant amount of research work as well. So with that backdrop, I'd like to share a little bit about our journey towards an enhanced digital consumer experience. And first, to sort of reflect on what USC is solving for in this space. What's the strategic imperative for us? And what we've realized is that today, consumers are not only comparing their experience as patients against other healthcare providers, but really against all the other experiences they have as a consumer. And so when we think about our plans for growth at Keck Medicine, in addition to investments in facilities, in physician workforce development, in clinical program development, we're really prioritizing digital engagement investments that drive patient loyalty and build and sustain a demand for our specialized services. We firmly believe that this investment in the digital consumer experience is a key to our success. While we definitely pride ourselves in a differentiated level of clinical care that our health enterprise delivers to our patients, we also think it's really important to provide a differentiated experience in terms of their experience interacting with our health system in all different facets, really. And so we've committed to bringing this enhanced digital experience to our patients, and really one that looks more towards what they're accustomed to experiencing in other, sort of leading industries. Seth mentioned, sort of the experience with travel, obviously Amazon, things like this, Spotify, looking more towards other leading consumer industries and what that digital experience looks like. And so what we've tried to do here at Keck is really focus on a few things. One is providing streamlined access. Second, digitally engaging our consumers. And when I say consumers, I think it's important to reflect on, we think of our patients as consumers, but also referring providers. As a TQ facility, our referring provider relationships are super important. And so that digital engagement strategy spans both patient digital engagement as well as referring provider digital engagement. We're focused on identifying the right strategic solutions partners, like Cedar, for example, and all this to build a differentiated consumer experience that ultimately drives patient loyalty and growth for our health system. So Seth made this distinction between systems of engagement and systems of record. What you see on this slide at the bottom are our core systems of record. We run Cerner EMR. Our facility billing is on PBAR, which is a legacy system from when we acquired Keck Hospital and Norris Cancer Center. We're actually in the process of transitioning to Cerner facility billing platform, so more integrated system of record on that side. I'm accountable for our professional billing at Keck, and we use Athena IDX there. We use Salesforce CRM as well. So those are our sort of core systems of record. When we think about systems of engagement that we layer on top of that, we're really focused in 4 key domain areas. First, patient access. This has been where we've done a lot of investment in providing digital solutions for our patients to interface on the front end, trying to book appointments. So, some basic stuff like IVR, an appointment reminder, et cetera, but also digital patient intake, check-in, e-consent, online self-scheduling coming soon. In the clinical domain, we're doing things like digital prescription refill support, nurse triage software, and remote patient monitoring. In the financial domain, which is the main focus of this presentation here, we're really focused on that single patient statement, combining the facility and the professional obligations. This self-service payment portal, which Cedar provides us, and a multi-channel communication, text, email, paper, that meets our consumer needs where they are. And then the final domain is around referral management. I talked about the importance of our referring provider network, but really coming up with new ways to digitally engage our referring physicians, provide streamlined workflow to them, speed to schedule for referred providers, and closed loop communications that tell them where they're at in the process. So that's sort of the framework by which we look at this layering of systems of engagement on top of core systems of record. This next slide presents sort of a timeline of the rollout of these enhanced digital capabilities and the resulting improvements in consumer loyalty and advocacy as measured by the Press Ganey likelihood to recommend percentile score. So the bar graph there is a trend graph of that likelihood to recommend score, showing increased patient loyalty and advocacy. And then the bubbles at the bottom are really the investments we've made and placed chronologically along that timeline in digital engagement strategies. This began in 2020 with our collaboration with Cedar and the patient financial engagement strategy. We have since enhanced in the other domain areas around patient access, around prescription refill and nurse triage, remote patient monitoring, and moving towards referral management and self-scheduling. The other point that I'll make here is that this is all rooted in a culture of commitment to an enhanced patient experience, and that's embodied here at Keck Medicine of VOC through these patient experience leader rounds, where our managers and directors are going out to meet on a monthly basis with our frontline staff and with our patients, checking in on how we're doing in terms of meeting that patient experience objective that we've set for ourselves. So next I want to talk a little bit about how we considered the need to invest in digital engagement, in particular around patient financial obligations. We identified back in 2019 a need to better engage patients around these self-pay obligations. Our key pain points were around technology, around people and process. I shared with you, we have multiple systems of record. We have separate facility and professional billing systems. We have separate patient statements. We had a lack of coordination and transparency with separate customer service teams, inconsistent collections policies, patient dissatisfaction and complaints, and all that really leading towards unsatisfactory financial outcomes, both for the health system as well as for our patients. We were seeing aging self-pay receivables, higher costs to collect, and for our patients, elevated bad debt write-offs. So next I want to share a little bit about the specifics of our work with Cedar. We initiated this partnership in 2020. Our goals were really to improve the patient financial experience, boost collections, and enhance how patients are engaged with us around these financial obligations, and driving self-service bill resolution. We launched the Cedar Pay platform in November of 2020. We did that across our hospitals and our medical group, and really built that single patient statement and that patient portal for interaction on patient bill pay. We proceeded in 2021 with some stabilization efforts, really just trying to build on the early success and continue to refine our offerings there. The key focus areas through 2022 were around the Cerner Soaring implementation, which is ongoing, and starting to get more precise around how we offer discounts at an invoice level. And that's really a key strategy to our success in the collections rates that we'll show, is this ability to think about payment plans and patient discounting in a dynamic way. And 2023 and beyond, optimization efforts, again, around our, ensuring that we have a seamless transition with this system of engagement, the Cedar Pay platform, as we swap out a system of record, which is a key, data source to that, obviously. The other thing that we're particularly excited about is the payer intelligence layer, which Seth mentioned a little bit of, and this ability to potentially begin to bring in EOB data from our key commercial payers, as well as HSA balances, and surface that all to our patients in that payment portal, so they can have the full view of their patient financial obligation and what resources might be available to them. And next, we're going to share some of the specific financial results, and I'll pass it to Seth for this slide.
Great, thank you. Yeah, we're super excited about the impact that we've delivered in partnership with Jeremy and his team, resulting from the work that he just went over. And there's a couple ways that we measure and look at that impact. First and most importantly, is we want to show there's a strong financial return. We know that in this environment, it's absolutely critical to show that there's a clear path to financial value. And so within the year of us launching, we were able to demonstrate a 39% increase in collections from patients. That is a meaningful increase, not least because it is a income impact, it is not revenue. And so if you think about the margin profiles of a lot of large providers, delivering on this income is super important. But importantly, it's not just about that financial value prop, it's the way in which we manage the patient experience. And so on that, there's a couple ways we look at how we're supporting patients in our mission. For example, to what extent are we able to offer flexible payment plans and ensure there's strong compliance against those? And over 85% of patients who sign up for those payment plans comply with them through the full part of the term, which is hugely important to them. And also really critical is digital engagement. This benefits both patients because patients really prefer self-service where possible, but also super important to the provider organizations as well, because I think as everyone knows, there's been a challenge around staffing in the last couple of years. And so any opportunity to move people to self-service and reduce servicing burden is a big deal. And so we're super proud that about 80% of all collections are completely self-service at Cedar. And last, but certainly not least, over 90% of patients are saying this is a better experience. And as we talked about in the beginning, loyalty is now emerging as a major driver from these patient billing experiences. So we're really excited to deliver that kind of satisfaction.
Thanks, Seth. And to build on that patient experience notion here, what we're showing here is actual comments that we're getting from patients in these real-time patient experience surveys through the Cedar Pay portal that really highlight the level of satisfaction that they have with this experience in terms of flexibility, in terms of self-service, in terms of the tools we're using. And I think I'd ask sort of a rhetorical question here to folks on the webinars. How many of you are getting real-time feedback on your patient financial experience and patient billing processes? And that's one of the great things that Cedar is provided for us. And the other thing I'll point out here is, these are comments from people who are paying a hospital or a medical group bill, right? Which isn't the favorite thing for everyone to do, and yet they're sort of delighted with the experience and how seamless the process has been. And so we think that not only the financial uplift, but the digital engagement and the patient experience that's delivered through this collaboration with Cedar is really important to us. In terms of ROI, we've calculated an 8.2x ROI on our investment with Cedar. We did this ROI exercise by establishing a baseline collection rate of patient financial obligations, and then looking at the subsequent uplift, the incremental collections that we're driving since the launch of the Cedar Pay platform and our single patient statement. And you can see through 2022, we collected an additional $22.4 million in incremental collections. And again, to Seth's point, that's cash collections, not revenue, right? That's directly to the bottom line margin of the health system. And so we're quite pleased with the results that we've been able to drive together, and the collaboration with Cedar on this.
So I think we want to kick off questions, right, Katie? So we want to, do we have any questions that we want to move to at this point? Oh, I see there is a question that's just coming through here, which is, what was the catalyst for your shift to improve the patient experience? So I think that was for you, Jeremy.
Sure. I mean, I think it gets at the increasing competitiveness of the healthcare marketplace and the need to differentiate on facets other than driving clinical care, right? And I think also the realization that healthcare as an industry is behind, or has been behind, in terms of thinking about strategies for digitally engaging our consumers and driving this patient experience. And so trying to get at the forefront of that and what I think will be a an overarching theme of healthcare providers, over the next many years, but trying to get out in front of that and find new ways to differentiate our health system in a very competitive landscape.
I believe this question is going to be for Jeremy also. There's a question in the chat. Are discounts based on prompt payments or are they scheduled? If the latter, any negative impact to the AR in the interim of these scheduled discounts?
Yeah, so we offer both. We offer a prompt pay discount, and we do based on patient financial needs some discounting as well. We bake that into our AR valuation since those are planned discounts. So we don't see any negative effect other than your obviously your discounting. So but we think that it's important strategy for patients to make it more affordable to access our specialty services when necessary.
And I have a question for Seth. Can you name one consumer-focused company that you admire and why?
There's a number of consumer-focused companies that I admire. Let me think of a good one here. I would say that it's kind of funny because I'm sitting here at the moment and the Delta Airlines airport lounge as I've been navigating travel. And so I will admit that while the airline experience can be frustrating for lots of reasons, I do admire Delta's commitment to the consumer experience. And I think there's been a number of things they've rolled out as I think about our digital work and I look at the app and the way that their app has evolved and everything from operational transparency. That's a term we think about a lot in Cedar. And what I mean by that is, they'll tell you when your luggage has been loaded on the belt and when it's coming and when to expect it, or kind of confirming it's coming along its path. I think a lot about that too, with respect to, where people are in their payment plans, how a cost estimate may have changed from the beginning of a visit to kind of where it goes. Like that operational transparency, I think Delta does very well. And so it happens to be top of mind given where I'm sitting at the moment.
Thanks for that. And I do see a question in the Zoom Q&A. And this could be for either of you, really. Is Cedar connecting any of your patients to financial assistance?
Jeremy, do you want me to take that, or you want to start and finish?
You can start, Seth, and I'm happy to tag on.
Yes, enthusiastically, yes. That is a really important part of our work. So every one of our clients, including for USC, we are very careful to understand the financial assistance policies and charity care policies that are in place. And we work really hard to figure out ways to digitize and simplify the connections to those programs for the consumers that are eligible. So we'll load the income criteria or whatever thresholds. And I think one of the big things that we get excited about is that usually, well, I won't say usually, it's often a challenging and somewhat paper-based experience. Sometimes you need to apply for aid. Sometimes you need to call a number, right? There's a number of steps to be done. We're trying our best to create more of a digital self-service approach. And so to date, we've done that work with clients like USC to really load those programs and help navigate. The thing I'm really excited about is just this past week, we're excited about this new partnership with a company called Advocacy that has APIs and connections into many financial assistance programs with over 200 providers today. And they do a lot to really streamline it's like kind of like an autofill for a lot of these applications that can be sometimes very cumbersome to fill out. So we're really delighted about our partnership with them because we think it's going to really help accelerate and make it super easy for patients who are in need of these programs getting the resources they need.
Yeah, and I'll just add to that. I think one of the things that we appreciate about Cedar is they make the process easier for our patients to seek financial assistance and to take advantage of financial assistance offerings. But it's built on our policies and how we want to approach it. So they're implementing what is our patient financial assistance policy and income thresholds and discount amounts, et cetera.
I see a number of questions now coming forth. So it's great because you're really generating a lot of engagement on the part of the audience here. Jeremy, you've got another one. You're just a popular man today. Does Keck Medicine offer service recoveries to patients when unfavorable outcomes such as long waits, errors with statements, etc.? Service recoveries.
Yeah, I mean, this gets into our risk management function. The short answer is yes. Obviously, that's you know a tricky area, but yes, we run that through our risk management function.
Okay. A question for Seth. Do you have clients using Epic? And how do you compare to the functionality in MyChart?
Yes, we have many
Softball.
clients using. Yeah, it's we're laughing because that's a very it's a good question. It's also one we get a lot. We have many clients on Epic, including some of the largest Epic clients nationally are including Providence and Allina Health, Hartford Healthcare, Novant Health. So those are all long-standing Epic clients that are using Cedar. Um, we don't think of ourselves as an alternative to Epic, but rather a complement. And this comes back to the beginning of the webinar where we talked about systems of record versus systems of engagement. We think that Epic fundamentally is a fantastic system of record. They do a great job of taking data from across the enterprise and putting it in one place and creating consistency in workflow. But for a consumer experience, you need something that's dynamic and personalized and engaging. And Epic doesn't have all those capabilities. They can't do dynamic texting. They don't personalize statements based on demographics. They don't include payer information like deductible balances or HSA balances, right? That's just, again, that's not a knock on Epic. It's just not something that Epic does today. It's not their DNA. Epic also doesn't guarantee results, which is what we do, right? We hold ourselves accountable for driving lift in the patient experience and collections. Epic does not do that. So we partner and we think of ourselves as a really important complement to those capabilities, but those are just some of the examples of kind of the gaps that we fill. And fundamentally, we like to think it's less about the features and just the results. If you look at our Epic clients, they're all seeing very similar results to what Jeremy shared, at least 20 to 30% increase in cash collections for Novant and Hartford and others.
Great. Really appreciate that comment because I do use MyChart and I can say that I do have some frustrations because even though I make a payment on MyChart through my HSA, I still get bills. I still receive paper bills for months even after that. So I mean, there always seems to be something's not syncing right within the system because
yeah. And I'll say that you have your MyChart experience, and sometimes it can be good, but not everybody uses MyChart. And that's the other thing we remind folks too, is that it's great if you're already in MyChart, but what about those folks that don't go there, or frankly have a small bill and don't want to have to log in just to pay off a $30 balance in between meetings, right? So we want to give another channel for people to engage.
Right. Okay. I was going to see if anyone else has any final questions. I don't see anything else in the chat currently. So please don't be shy. And I definitely, Jeremy, also, I really appreciated your comment about building loyalty because I can say that I'm on my third different health system because of the fact that I could not get the billing, essentially worked out or reconciled with the first system I went to during COVID, then the second when I got COVID again. And then finally, the third system finally got it right. So I've been with them ever since, simply because of the negative billing experience. Right? Being basically care agnostic because they're all great providers. Right?
Yeah, thanks for that comment. Yeah, we do think that is super important, right? And that loyalty in any way we can enhance loyalty to our health system. And this being a real key way because it's a point of friction, right? It's generally a point of friction, and we're making it a point that, and you can see from those comments, right? It's a point of sort of delight, which is odd to think about, but is the reality. And I think making that flip has been super impactful.
And seeing no other questions, I just really want to open it up to either of you two. Do you have any final thoughts or comments that you'd like to share with the universe? And we just got a question. Sorry. pardon me, before your final thought, excuse me, describe the training provided to the customer service team to be proficient with handling patient complaints, including the use of scripts, etc.
I'm probably not going to be able to do that justice, but I will say we have a robust training program. We do still maintain two separate customer service teams. So we have a dedicated team for our professional billing and a dedicated team for our facility billing. Both are looking at, same information and could share information. That's been one of the key things that Cedar has helped drive for us. But we feel like having specialized folks who understand professional billing versus facility billing is still important. So we've made a decision to keep those separate customer services teams in place. We do provide robust training for them. We also do, sort of call recording and feedback loops and things like that. I'm pretty certain we're using scripting, but I can't speak in great level of detail on the specifics there.
And I'd say if that's of interest, you can follow up with us, and we can also do our best to help put you in touch with folks who might know more about that. So happy to help. In terms of final thoughts, Jeremy, do you have anything you wanted to conclude with?
I just think that there's a real opportunity here. We saw it. It's like I said, taking a pain point and making it an opportunity to delight our patients. And doing it in an area which has very clear ROI, right? We're improving our collections rate. We're reducing the cost to collect by driving self-service. And so from we're all in a business that margins are super tight, and it's a challenging business to manage. And so finding areas where you can invest, drive patient experience, drive loyalty, and get a nice ROI are rare, right? And so that's kind of why we prioritize this in the first step of our digital transformation journey, and why we're really pleased with the results.
Yeah, thanks for that. I'll just build on that too. Yeah, I would say this is a tough environment, as Jeremy noted. And we talk to so many providers who are struggling with inflated cost structure, staffing shortages, and now it seems to be the hot topic is like payer denials, right? The denials seem to be up across all payers, right? And so these are structural, hard challenges that are not, there was no easy fix. And so one of the things we get really excited about is that if your payer reimbursements are capped and you're struggling with denials and your cost structure is kind of fixed and you're struggling with inflation, the one place where there's some unlock is this patient component. Because if you're writing off 50 or 60% of the dollars that your patients owe you, and they make up 10 to 15% of what your overall reimbursement is, well, then that's a very meaningful opportunity to go after, where you might be more confined or restricted in other places. So it feels like in this moment in time, it's more important than ever to focus here, because other places there's just less upside, there's less opportunity. So.
Great. Really appreciate those thoughts. And I would say, I really want to thank everyone for their participation. Great questions. And of course, I love the content, something that's near and dear to my heart. And I really want to send a shout out to the person who had the question about the patient financial assistance as well, because that's definitely something that's key here in California, given all of the our Attorney General here. So, but I'd like to thank everyone again for their time, and I believe we're going to give you back, I guess, 14 minutes of your valuable time back, and I hope everyone has a great day. And Seth, safe travels.
Thank you.
Thank you, everyone.
Thanks so much.
Thank you very much.
Bye all.